We were all working in a small hospital. We all had experience on the surgical floor, and it was noticed by a group of us that patients seemed to be starved of fluids and solids pre-operatively for prolonged periods of time, and we decided to measure initially how long patients were being starved for a 2-week period, and we demonstrated that patients were being starved of solids for over 3 times the recommended amount by the government and national guidance, and from fluids 6 times. So we obviously recognise that as something that could be improved. With a registrar in orthopaedics, he devised some signs, one for the morning list and one for the afternoon list, and then we were able to demonstrate that times in which they could be starved for solids and for clear fluids separately, which was 6 hours and 2 hours respectively. We also then did a short PowerPoint presentation which we shared with all of the nursing and HCA staff on the surgical wards. We also presented it at the surgical MDT, ICMDT, and had the backing from all the different surgical specialties, and we had a lot of help from the ward sisters as well in implementing it. We then waited for like a loo period to allow the signs to take effect, and we then used the same data collection tool over the same 2-week period again and remeasured how long patients were being starved and compared it to the previous results. We were very surprised and greatly pleased to find out that our patients, I think for solids there was a reduction of 32% on average waiting time. Obviously there's skewing those things, and then with regards to fluids, patients have been a reduction of 40%, so we're really amazed by that. We also find that in our first data collection before intervention there was 11 patients that were starved inappropriately of breakfast because they were actually on the afternoon lists. That then meant that because of the signs that number had actually been reduced to 0. I think because I had a grounding in at university, I'm quite passionate about quality improvement because you can actually make a difference in the trust that you're in. As a junior doctor, we move trust almost annually, and you become part of the team and you can make a change and reflect that in your own practice. It's something that's tangible and visible. Quality improvement makes you consider your own environment and work in a team, and it's not it moves away from, I think, the blame culture and more about how can we make it better.